Muscles in the anterior compartment of the forearm, three categories: superficial muscles, intermediate muscles, and deep muscles. Perform flexion and the wrist and fingers and pronation. The superficial muscles, flexor carpi ulnaris, palmaris longus, flexor carpi radialis, pronator teres. They originate from the medial epicondyle of the humerus. Flexor carpi ulnaris passes into the wrist and attach to the pisiform carpal bone. Actions: flexion and adduction at the wrist. Palmaris longus attached to the flexor retinaculum of the wrist. Action: flexion of the wrist. Flexor carpi radialis attached to the base of metacarpals 2 and 3. Actions: flexion and abduction as the wrist. Pronator teres has two origins. One from the medial epicondyle and the other from the coronoid fossa of the ulna. It attaches laterally to the midshaft of the radius. Actions: pronation of the forearm. The flexor digitorum superficialis is the only muscles of the intermediate compartment. Two heads, one originates from the medial epicondyle of the humerus, the other from the radius. The muscle is split into four tendons as the wrist, which travel through carpal tunnel and attach to the medial phalangeal of the four fingers. Actions: flexes the metacarpophalangeal joint and proximal interphalangeal joints at the four fingers and flexes as the wrist. There are three muscles in the deep anterior forearm: flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. Flexor digitorum profundus originate from the ulna and associate interosseous membrane. At the wrist is split into four tendons that pass through the carpal tunnel and attach to the distal phalangeal of the four fingers. Actions: it is only muscles that can flex the distal interphalangeal joint of the fingers. It also flexes at the metacarpophalangeal joint and at the wrist. Flexor pollicis longus originates from the anterior surface of the radius and surrounding interosseous membrane, attached to the base of distal phalanx of the thumb. Actions: flex the interphalangeal joint and metacarpophalangeal joints of the thumb. Pronator quadratus originates from the anterior surface of the ulna and attached to the anterior surface of the radius, a ischias-shaped muscle. Actions: pronates the forearm. Flexor carpi ulnaris and the medial half of flexor digitorum profundus are innervated by ulnar nerve. Other muscles are innervated by medial nerve. Subscribe Quick Anatomy.